And joining us now on USCAP TV, Dr. Chris Crum. He is this year's Nathan Kaufman Timely Topics Plenary Lecturer. This must be an absolute honor for you.
Yes, it's a great honor. Nathan Kaufman was a major figure in the United States Canadian Academy of Pathology for many years, and to me this is one of the biggest honors I've ever received. To give this lecture it's almost too much of an honor for some of us, but we'll be up to the task, and I certainly enjoy being here and having the opportunity to give this presentation.
And so your speech, or your talk, is going to talk primarily about gynecologic pathology, your specialty?
That's correct, and it takes it from different perspectives. You know, gynecologic pathology is really at the very core of gynecologic cancer care, as well as the care of other gynecologic diseases. Mainly because in that particular discipline, the clinician relies very heavily on our diagnosis. In addition, as a gynecologic pathologist, you have a window, into the origins of cancer and disease. And so the gynecologic pathologist in practice is very valuable to their clinician and to the care of the patient. And in research and in investigation, the gynecologic pathologist has the opportunity to see things that no one else can see because they're looking through the microscope. And in doing so, they may see things that are quite important and give us understanding about the genesis of cancer.
What are the biggest misconceptions, would you say, within the medical community?
Well, I think a lot of them have to do with how tumors originate. If you look at what is the major thrust of research nowadays, a lot of the work, of course, is directed towards molecular analysis, the molecular understanding of diseases. And this is extremely important because by understanding the molecular aspects, we understand perhaps some of the genes that can be targeted for therapy. On the other hand, as a pathologist, you're also looking at potential origins. And you can have all of the molecular information in the world and still not be able to have an impact on a disease, whereas if you understand exactly how it begins, you can ask completely different questions. So I think the general community sort of sees these diseases in a more limited context. They're patients, they want to be treated. For obvious reasons, we put a lot of emphasis on that. At the same time, if you understand the origin of a disease, you may save future patients. So pathologists, in my opinion, have the keys to the future.
And when you talk with these other gynecologic pathologists here, especially during the convention, what are some of the issues that they bring up?
Well, I think in gynecologic pathology, a lot of it has to do with classification of tumors in terms of how they'll be managed. So much of pathology, as you know, is classification. What is this tumor? Where does it come from? What does it do? At the same time, another major issue that's emerging are the origins. For example, the origins of cervical cancer or the origins of ovarian cancer have become very big topics in recent years. The origins of endometrial cancer, the lining of the uterus. Mm-hmm. The origins of all these lesions and these tumors is becoming a focus in pathology as we begin to actually look at smaller and smaller things. We're used to looking at very large tumors, unfortunate byproducts of disease that may have gone too long. At the same time, we're learning more and more to look at the smaller things, the very beginnings of cancer, and that's really a purview that belongs to the pathologist.
And your talk tomorrow, Monday, what do you hope that attendees take away after hearing your talk?
Well, I hope that they'll understand a couple of things. Number one is, they're all pathologists like I am, so they love details. They love to see microscopic details. At the same time, they want to understand what these small things that we find mean in terms of cancer outcome. What do they mean? What do they mean clinically? And I think pathologists are beginning to grasp the fact that not everything we see is necessarily of clinical significance, but may have important biologic significance. So I want the attendees to both understand the clinical importance as well as the biologic significance and understand it in the broader scale of learning and how one acquires information and how one can take something, let's say, from cervical cancer research and actually be able to translate it to ovarian cancer research. Mm-hmm. Two diseases that seem quite different but actually have things in common.
Look forward to hearing that speech. Thank you so much, Dr. Chris Crum. I appreciate you stopping by and talking with us today.
I can't wait, and thanks for the opportunity to talk to you.